is a real problem in our society because people are obese and people are getting more and more obese. We are, I think it's the first or second country in the world that has the highest growth of obesity amongst children.
Wow.
That's not a great statistic to have at all. So what we're trying to look at is how do we make an environment that's better for children to grow up? What are the things that you can do? So first of all, in terms of marketing, many countries have done it, is they restrict marketing to children. Some countries don't allow any marketing to children at all, of anything. Some restrict marketing. We sort of restrict marketing of alcohol, sort of, but we don't restrict marketing, and, well, we don't have a law restricting marketing to children, put it that way.
Hey everyone, on the show with me today is Professor Susan Goldstein, who is the Division Director at the South African Medical Research Council Centre for Health Economics and Decision Science, PRICELESS SA. And in this episode, we are going to talk about her team and the work that they're doing at the intersection of research, economics, and policy to help South Africa make better decisions about health. What to fund, what saves lives, and what creates the greatest impact with the limited resources that we have. In this episode, we unpack how decision science actually works, why prevention is so often undervalued, and how issues like inequality in politics shape the health outcomes we see every day. It's a conversation about evidence, ethics, and the real-world trade-offs behind building a fairer health system. You can check Susan and the fantastic work that her and her team does in the links below in the show notes. And if you like this episode, please share it. All right, let's get into it. Susan Goldstein, welcome to the Expect Performance podcast. Lovely to have you.
Thank you. Nice to be here.
Sue, how would you describe what you do for a living to somebody that you've just met?
I do research which looks at how things impact on people's health. So it's health research. I want to find out how to improve people's health at a general population level. So I'm not looking at individuals. I don't go and measure people and look at people, but I'm looking at things in the general environment that affect health. So, for example, we look at how sugar or sugary beverages affect people's health and make them help contribute to them becoming obese. And what are the policies that we can introduce that will help to decrease that? So that's kind of what I do. I'm overseeing a team of lawyers and economists and public health specialists.
Okay, interesting. I read some of your research on sugary beverages, particularly with respect to the advertising space, and how that targets youngsters, and I think you also made mention, or perhaps it was a different article or study, but with respect to cereals as well, breakfast cereals and the likes. How is our current economic policy and our, if you want to call it advertising and marketing, how is that impacting the decisions that we're making as a consumer with respect to those sugary drinks and breakfasts, etc.?
Well, that's a great question. It's a complicated space. So what happened over the years and has happened is that food manufacturers have added sugar, salt, and fats to make it very tasty. So that's the one approach that they've done. So a lot of our food that we eat that is processed has got far too much sugar, far too much salt, and far too many fats. So that's the one aspect. There's a second aspect. In order to sell their products, they advertise, and the advertising market to children is very good for them because they say that they have children are a threefold target. So children are a target because of themselves and what they call pester power. Children are a target for the future. And then, of course, if they they themselves have pocket money, then they can use that. So it's sort of threefold. They're influencing what to buy in three different ways. And I think they also argue that if you can get them young and committed to your brand, then you've won. Then you can relax if you like.
Yes.
So I think targeting children specifically with sugary beverages, but with lots of unhealthy foods, is a real problem in our society because people are obese and people are getting more and more obese. We are, I think it's the first or second country in the world that has the highest growth of obesity amongst children.
Wow.
And that's not a great statistic to have at all. So what we're trying to look at is how do we make an environment that's better for children to grow up? What are the things that you can do? So first of all, in terms of marketing, many countries have done it, is they restrict marketing to children. Some countries don't allow any marketing to children at all, of anything. Some restrict marketing. We sort of restrict marketing of alcohol, sort of, but we don't restrict marketing. And, well, we don't have a law restricting marketing to children, put it that way. There is what they call a voluntary code that big companies like Coca-Cola have signed, which say they won't market to children. But it's kind of old-fashioned because they're talking about television, mainly television, so they don't do it during children's time, which is also questionable. But now there's social media, there's outdoor advertising, there's marketing at schools. It's just not working. So what we actually need is we need formal restrictions on marketing to children, laws, basically.
Yeah.
And I know some people call it the nanny state, but actually, it's just protecting people's health. The people who are doing the marketing have no interest in your health at all. All they're interested in is making money, which is their right because they are a company. That's what they're supposed to do. But it comes at the expense of especially our children's health.
Yeah. So what you described to me there is something, I think of the word health economics. So what is, first of all, you've got your economics and the transfer of money that changes place from consumer to consumer, from business to business, from business to consumer. And then you've got obviously the health aspect to that. For the layperson, how would you describe the term health economics?
Well, it's about what is the cost of health, really. I think that's what we're talking about. So, for example, when I'm talking about obesity, we want to know what does obesity cost the individual? So how does it impact on your health? And then once it's impacted on your health, so for example, once you have diabetes, what is that diabetes going to cost you as an individual? You have to pay, you have to take time off work. Sometimes you lose your job. You may have to go to hospital, all sorts of things. You may have to get a caregiver. Those kinds of things can impact on an individual. But at a societal level, what we've got is we've got the health system. So the cost to the health system of having a lot of obese people is that we're going to have a lot more people treated for hypertension, for diabetes, for heart disease. We can't afford it. None of us can afford it. So what happens is you look at what we do in health economics is we look at the cost and we look at the benefits of whatever it is that we're looking at. So the cost, for example, of diabetes and obesity to the country and to the individual, and what then are the benefits, for example, of taxing sugary beverages or front of pack labeling of ultra processed foods. What are those things so how does it balance out? Because in the end, when we're talking economy and we're talking money, the people that make policies want to know how it balances out. If it's going to cost the country more, they're going to say, no, we're not interested.
Yeah, it seems to me that there would be there'd be a crossroads between what is economically fruitful and then also what might be necessarily healthy for the individuals en masse, even though you've already outlined the fact that obesity and those non-communicable diseases cost the South African economy billions every year. It seems that we are in a bit of a predicament where we have to decide between prevention as being better than cure, and the feasibility of those things financially. So what are the things that we can do, and from a policy standpoint, to help prevent and slow that curve of your diabetes, your obesity pandemics that we find?
So there's just to quickly correct you that the prevention is always more cost effective than the cure.
Okay.
It always comes out like that. But what we can do what other countries have done, and there probably are other ways that we haven't thought about yet. But what we can do is we can increase taxes. Increasing taxes has been shown to work with tobacco. A lot of people stopped smoking when the taxes increased. It works partly with alcohol, although it's not very highly taxed. But you can increase taxes. And in some countries, they have taxes on sugary beverages and ultra-processed foods. But we're just looking at sugary beverages at the moment. You can put labels on ultra-processed foods which tell people what's bad in them, put it like that. So, for example, we got a regulation that's in process at the moment with the Department of Health that will have a warning label on packaged foods. And that warning label will say, I think it's like it's a little label that looks like a stop sign, and it says high in, and then it can be high in sugar, high in salt, high in fat, or it may have non-nutrient sweeteners. And those things, it makes it easy if it's on the front of the package that you're getting. It makes it easy for somebody to make a healthier choice. At the moment, the only labeling that we have is on the very back of the package. And those things are in tiny little font. You can hardly see them. And it's hard to interpret what is going on. So how do I know if 16 grams of sugar in 100 ml is good for me or not? I don't know.
Yeah, exactly.
So how do we know? So it's very clear that we can have this front of pack labeling. And I think that will be very helpful also about what can be advertised. Some countries, as I've said before, ban advertising to children. I'm thinking that we could ban advertising of labeled foods because basically they're really bad for people. And it seems like what's the advantage of advertising? And then finally, well, for the basis of this, you need what they call a nutrient model. So we have to have something agreed nationally that we're basing this on. So if we have, for example, over X sugar per 100 mils, then that's part of our model. So I think there's a lot that can be done. The other side of it, which we haven't worked out what the best thing to do is making sure that there's healthy food available. So particularly with poor people, they argue that healthy food is more expensive. And therefore, we're going to choose the easier thing. Sometimes people don't have access to cooking facilities. Sometimes fuel's expensive. Sometimes it's just not easily available. All the kind of healthy foods are in fancy stores like Woolworths. So there's all this argument, and we have to look at how do we make sure that people who don't have money have access to healthy foods.
Yes. So a couple of things on that point. There seems to be also inevitably there'll be a debate when it comes to syntax and that sort of thing, that these big companies that are in charge of sugary beverages, etc., and unhealthy labeled foods are a big portion. They're a big portion of the economy, and they employ a lot of people, and as a result, then if those people have the ability and capacity to spend those staff, then perhaps they might be likely to use their money in more in wiser ways. Maybe they will, maybe they won't. I'm not sure. But that, as always, seems to be the argument, that job creation, right?
Yeah.
And then if you come after these big companies with taxing them, et cetera, then there's going to be a loss of jobs, and employment will continue to decrease. Do you have anything to say on that narrative?
Yeah, so absolutely, and we're very aware that's the first thing that the big big tobacco, big alcohol say when you try and tax their product. I think what was clear with tobacco, it was very interesting, which is an example, is when tobacco advertising was banned, when the taxes went up, um, the economy did not collapse. For a short while, advertisers, the advertising industry they did suffer for a short while, but then other things jumped in. And I think that that's the point, is that, okay, if cocaine was legal, would we be encouraging production because it made jobs? Or another illegal substance, heroin maybe? I mean, the question is, what are the values of our society? And anyway, but apart from all that, apart from all the values and so on, we did a study which looked at the introduction of the sugary beverage tax, or the health promotion levy it's called, which was done in 2018. And we looked at a time series from before 2018 through to 2022 to see if there were job losses. And there were job losses over COVID. That was a big period of job losses across the economy. And then it became normal again. So the job losses were not shown to be associated with the tax. So I
Wow,
think
that's fascinating.
what happens with big business is that, look, they use every tool that they have to make money because that's their job. They have a number of strategies to get people in ordinary people like us to understand or to buy their product. So the one strategy is that they fund research. So they fund research which will contradict or change how people think. So one of the areas which you'll be interested in is they funded a whole lot of research around sugar, which they wanted to show that that the best treatment for obesity is exercise. And they were arguing that sugar is not important. And actually, when it came, the eventual results have come out that actually that's not the case. People can exercise, and it's very good for them, and I'm not arguing against it at all.
Yes.
But it's not necessarily going to reduce their obesity because of what they're eating and because of the kinds of things that are in the food that they're eating. So they influence research. They influence politicians. So policies like banning advertising to children don't get anywhere because they have been got to by the industry. So the industry use the arguments that you've put forward, but they also do things like they pay politicians, they contribute to political parties, they even, and some of them are completely above board. So the sort of corporate social responsibility. They sponsor sports teams. They build their brand and they say, look at us, we're fantastic. We're really supporting this economy. So don't tax us. Don't try and stop us from selling what we're doing. So that's just two of the ways. There are a number of other things that we've noticed over the years. One, for example, is called the revolving door, where people who sit on boards of these big companies go into politics. Well, our president is a really good example of this. He was on McDonald's, and of course now he's president. He did resign his boardship of McDonald's, but the affinity is still there with that kind of business. Then there are also other people who go from politics to be on the boards of these big food or big alcohol or big tobacco. So that's another way of influencing policy. And yeah, so there's some of these ways that are influencing policy and some ways that are influencing communities. I've been in schools where they're advertising Coca-Cola, and the schools say, and they've got these big boards of the school's names, and the schools say, but we've got no money to put up a nice board for our school. So this is just something that we're doing, and not really thinking through what the consequences might be of that. And in some countries, like in Brazil, they ban advertising of any foods to children at schools at all.
And what is there any research on that?
in Brazil.
Yeah, yeah.
Yeah, they've just come from a meeting that we had in Brazil, in fact. Their school system, their school feeding system is excellent. They provide only healthy foods, and they've stopped advertising in the schools, and they're starting to show a decrease in obesity.
Wow. I can imagine that to be a very slow turning wheel.
Oh, yeah. It's
Yeah.
not easy
So
to show.
yeah,
Yeah,
you're only going to show that in 10, 15
yeah,
years time, I'd imagine.
exactly. Yeah,
You spoke earlier about prevention being cheaper
yeah.
than cure. Why is it, at least this is my opinion from the outside looking in, it seems to me that prevention, despite the fact that it might be cheaper, it seems to be harder to prioritize with respect to policy. Why do you think that that is?
Well, being a doctor, and I am a medical doctor, I think that when you're confronted with somebody who's sick, it's very hard to turn them away. I mean, you're ethically obliged to treat them. And I think that's how our whole health system is focused in a way. So, all the health thing is about treating people. Funnily enough, I mean, personally, that's where I came from. I was working in primary healthcare. I worked in a clinic in Soweto. And I got so incredibly frustrated because we had these long queues of people. And yet, most of what I was treating was preventable. So things like hypertension and diabetes and so on. And I just got really frustrated, which is why I moved into doing public health. But it's really, I think that, and if you discuss with people in the Department of Health, they will all tell you prevention is better than cure and more important, but they don't allocate any budget. And that is because they've got to treat the people that are already sick, and there isn't even enough budget to do that.
Mm,
So it's a difficult one. I mean, some countries. So in Australia, when the tobacco ban came in many years ago, what they did is they set up an organization called a Health Promotion Foundation. And that organization was funded by 1% of excise tax on tobacco. So they didn't take the health budget, they left the health budget alone, and they used that money to promote health. And what they did was they thought there might be a decrease in advertising revenue, there might be a decrease in sports sponsorship and so on, which the tobacco companies were doing. So they used that money to advertise healthy things, and they sponsored sports teams with healthy logos such as, I'm trying to think, I think it was condoms or something healthy.
mm,
And since then, the Health Promotion Foundation has been running, and it's been trying to promote health, looking at the prevention side rather than only on the cure side. So my belief after all these years of trying to get prevention on the agenda is that you have to have a separate funding stream for prevention. And it actually doesn't necessarily have to be controlled by the Department of Health. In fact, it's much better to be multidisciplinary and not in the Department of Health, separate from those health facilities. So
yeah.
that's sort of my thinking at the moment around why prevention is so hard to get on the agenda. The other part of it is that the objections, of course, of industry. So often this is saying, let's cut back on this, let's change how we do things industrial wise. And the industry, of course, don't want to do it because it might impact their bottom line. So they have huge influence as well.
Mm, sure. It must be incredibly frustrating from that standpoint, where you're coming up against massive conglomerates who have endless budgets to influence,
Yeah.
not illegally, but have tremendous influence in terms of campaigns that they can have and to host events. And there was I can't remember, it wasn't too long ago, in fact, that one of your big fast food chains became one of our title sponsors for one of our national sides. I can't remember if it was our cricket side or if it was or if our rugby
Okay,
side.
see, I think, and no, Coca-Cola sponsors our soccer team, I think, maybe
Mm,
rugby team.
mm,
Yeah, I mean, it's
yeah.
prolific. Yeah.
Yeah. And then you look
What
at,
was worse was the sponsorship of, there was an a thing that happened in the Western Cape. I think it was in the Western Cape or Eastern Cape, where there was this kind of desk that children could fold up in, could be like you could pull it along. It was sort of a trolley, and then you take it to school with your things and you open it out and it becomes a desk. And, they were saying, oh, this is fantastic. This is so wonderful because children don't have desks. But they were all branded McDonald's. So these are small children. How do you do that? And I think the problem is it's not regulated. So the industry are always going to think of clever things to do to increase their markets. I mean, that's it, as I say, it's their job.
yeah. So you've no doubt come across a whole lot of evidence and across the numerous studies that you've conducted over the years. Is there a study that's come to mind that comes to mind for you where it proved you wrong? It proved your assumptions wrong or your hypothesis wrong on something.
I think I can't think offhand of one particular one, because often what we do is we follow what other people are doing. We don't do a lot of kind of very new research, but there are things that don't work. There's definitely things that don't work.
What doesn't
and
work?
we have to, so things that, one of the things that I learned, and I'm coming from now also another different background, where I was in Soul City, which is a mass media communication campaign, which I was involved with for many years, and around health. And when I came to Soul City, we thought, okay, if you just educate people about how to prevent illness. For example, if you just tell them that you can use oral rehydration solution, their child will not die from diarrhea. Simple, straightforward. So we did our intervention. We had a TV program, we had print, and my role was research. So I was monitoring and evaluating what came out of it. And I think what I learned over the years, and very clearly, was that knowledge is not enough. Knowledge helps a little bit, but it's not enough. So one of the example with oral rehydration with diarrhea is we found out that we taught them to make this oral rehydration solution in a 2-liter bottle. And people said, but we went to find out, did you do it? Yeah, they learned about it, but they didn't have 2-liter bottles, or they didn't have water to put in the bottles. I think it started to become clear that you need much more. Then when AIDS came along and we were looking at safer sexual behaviors, it was very clear that knowledge, again, is not enough. You have to have an environment that makes people able to prevent the disease. So an example of that is that a young girl, well, I'm not even going to talk about rape, but I'm going to be talking about the sort of sugar daddy thing. And you can say, well, she's a bad girl because she went to him for money, wada. But often these young girls, in the context of great poverty in our country, are actually putting food on their families' tables through having a sugar daddy. And that's something that became very clear to us. So it's not just about knowledge, it's also about making the environment one where people can be safe.
Yeah.
I don't know if
How
that
does
answers your
one?
question. I sort of went on a
Yeah.
bit of a rave.
No, that's why we're here. That's why we're here. So what you're speaking about there reminds me of a book that I've quoted many times on this show, Atomic Habits by James Clear. And he talks about, you don't rise to the level of your expectations, you fall to the level of your systems. So despite the fact that something, like it's good to go to gym, it's good to drink, let's pick a rough number, 2 liters of water a day. You know that it's good to have a diverse range of healthy foods, a bright, colorful plates of food. This is not new information to people, and yet somehow, to a large degree, they aren't able to implement that consistently. So it then comes back to, okay, what are the systems in place that when I revert back to my default, what is
Yeah.
easily and readily accessible. So
Yeah.
it's about creating things that are difficult to do, have barriers to entry, they have obstacles.
Yeah.
And then things that are easy to do have no barriers to entry. So if you've got
Yeah.
a chocolate in the pantry, you're more likely to eat the chocolate than you are to, if there's no chocolate in the pantry, to then drive to the petrol station, get in your car, off you go, stop, get a
Yes.
chocolate, drive back. So I that's what I'm thinking about from a self-improvement and habit
Mm.
formation point of view when you're talking about that. How can we, whatever that might be, it could be healthy eating, it could be with respect to sexual behavior. How can we stack the deck in the favor of the public to make these healthier decisions more easier to make?
Yeah, there are lots of ways of doing it. I think so for example, with safe sex, making sure that the tools for safe sex are easily available. So condoms, which used to be, now condoms have seemed to have fallen off the radar as far as I haven't seen them around. They used to be available everywhere, and I think that was
Mm,
fairly effective. There are other prevention tools around safe sex, but I think there are other things that one can do to make life easier. So if you've got a very busy day and you need fast foods, I mean, everybody at some point, they haven't got time for cooking, they've got toddlers that are getting in their hair, they're exhausted, whatever, then why don't we have healthy fast foods available? You know, there are
mm,
ways of doing it. I think that we need to be thinking in a different way about how we live and how we eat. I mean, also just getting to the gym. How do you integrate it into your day to make it a routine? And I think routine is quite an important thing. You know, if you have every week you've got a commitment, you're going to go and do it every day or every week, whatever it is. I think routine helps people a lot. But one of the big barriers, in my view, in South Africa is transport. So
mm-hmm.
for a lot of people, and I'm sorry, I talk a lot about poor people, but a lot of poor people have to catch taxis. It's not clear whether there will be a taxi or there won't be a taxi. You know, there are a lot of them, but it's not like we've got a good public transport system that you can actually hop on and hop off and you know when it's going to come and you know where it's going to go, like in many other countries. And that's a barrier for people to get to places on time, to actually plan their day, to look after their children and so on. So there are a lot of things that need to be in place to make a healthy society. And I think that we've just focused on the one little area in our work, and trying to look at the food, making healthy food available, which we're hoping will make a difference. But yeah, there are a lot of things that the nudges, as you say. I think what the nudges mean to me is really making the environment healthier. So there are some
Yes.
interventions. For example, it's called a healthy school environment, a healthy school project. And what they do is they bring all the stakeholders together, so teachers, parents, and children, and they look at what's going to make our school healthier. And for different schools, it's different things. So some schools say we need to put a fence around our school to protect our children. Other schools say we need a bullying policy, or we need both. You know, so I think
Mm.
it's also about people getting involved in their own in decisions around what is good for us. And I think part of our problem, and I'm probably going to sound quite old-fashioned, is that we don't work together as a community very often. So even where we live in South Africa, often we live separate from other people. We're afraid of other people. We live with high walls. We don't work together to say, okay, what's good for all of us? What's good for some of us? You know, we can work in our small spaces, and make changes that I think can be quite effective.
Yeah. 2 points on that. Firstly,
Yeah.
this is why I love having these types of conversations, because I never thought for one second that our conversation was going to get linked to the public transport system and how that's going to impact on the health of the nation. But
Yeah,
when you talk about it, it makes perfect sense, because
yeah,
we revert to what is convenient and to what's readily accessible and available in that moment if our day goes for a ball. And
yeah,
if you don't know when you're going to get somewhere, and how long it's going to take, and if you, God forbid, you've got kids that you've got to think about what food to get them, just to get food for yourself must be difficult. And then you
yeah,
invariably end up relying on what's convenient. So, these spaza shops on the side of the road that sell knickknacks and sell cokes, and they sell those sorts of
exactly.
things that also don't go off and expire,
Yeah,
because there's a
that's that. Yeah, we haven't got
there's
fridge.
yes,
Yeah,
yeah, so there's that.
yeah,
And you start to then add all those pieces of the puzzle up, and then that's how you get the macro of the obesity rate that we've got in this country. And then it starts to all make sense, and you think, wow, okay, I can actually see how all of these things are contributing to this problem that we've now got ourselves in. And it's
yeah,
not as simple then as saying, okay, we need to, okay, it might be a good thing to start with, but it's not going to be as simple as saying, okay, we need to put big warning labels on labeled foods, because there's a massive percentage of the population that very seldom even get into
yeah,
stores like that in the first place. So,
yeah,
I mean, that's just so fascinating. And unfortunately, in a society that is as polarizing with respect to wealth and to the disparity of wealth
yeah,
is so great, that it becomes difficult then also from a community sense. I fully agree with you when you say we've lost our sense of community. um, and I think part of that is through technology. I think because we don't necessarily have to integrate face to
mm,
face as often as we needed to previously. There's good and bad things about it. If it wasn't for technology, we wouldn't be having this discussion right now.
mm,
But number two, it's bad because you don't have to go to the grocer anymore. You don't have to go to the local
mm,
butcher. You don't have to integrate and get to know the people in your community if you don't want to. And we spoke earlier about barriers to entry. So there, from a community standpoint, there are those barriers to entry where you can just go ahead with technology and it'll do it for you. You can get 60/60 to deliver your food, for example. You don't have to go to the shop. You don't
yeah,
need to know the manager of the store. So, all of these things start to add up and then compound and have an effect. But I think a massive part of this is the inequality that we've got.
mm,
And how does one come together in a community where you can have on one side of the road, proverbially speaking, houses that average 4 or 5 million rand, and then not 3 or 4 minutes away down the drag, you've got squatter
yeah,
camps and low cost housing. So how does one find the mutual ground to then pull together as a community to find out how we draw together? Because the needs of those two populations are so different.
very
And I
different.
suppose
Yeah,
that is, yeah, and I suppose that is the ultimate quest, is how do we
yeah,
bring those people closer together through health economics, through policy, to stack the deck in the favor of the people that are less fortunate. I would say would be the best place to start.
yeah. No, I think that's a fantastic question, and it's the $1 million question, really. But I mean, it's not actually that complicated, and it's improved in many countries. Inequality. The complication in South Africa is that is corruption. Because in many countries, there's a lot of solidarity between people who have and those who have not. And I, for one, would be very happy to pay even more tax if it meant that we had proper health services, that we had good schools, etc. At the moment, the people who are wealthy are paying a double tax, if you like. So we are paying now for private healthcare because the health services are collapsing. We're paying for private schooling for children because the schools are collapsing. We're paying for private security because we can't trust the South African police, or they're not good enough, whatever. I think those kinds of things, if we were in a country where there was no corruption and there was a genuine commitment to development, I think that I believe that most people are quite generous and empathetic and would be keen to support other communities and help with development. It's just that we've gone in a really terrible direction. And I think that there's this belief, there's a belief that there's what they call the trickle down philosophy. If you only made some people wealthy, then eventually it will trickle down to the rest of the community. And of course, that has been shown to not work. It's quite clear that it hasn't, because we haven't improved in inequality over the last 30 years at all. So I think there are many ways to do it, but it is a matter of, in my view, of really cleaning up the government and making sure that the services that we are paying for are good. And it's not rocket science, really.
Yeah, yeah. What about the people who are in positions to be able to make decisions? We go into your regular run-of-the-mill stores, and your massive chains. Everybody will know who they are. But I read an interesting piece of work by yourself again about the bundling of products,
Yeah.
and how that incentivizes people to invariably bundle and purchase 3 or 4 unhealthy products, and you might have a saving of 14, 15, 16%. And maybe a place to start would be to be simply aware of those tactics. And then secondly, why can't we do the opposite and bundle healthy products?
And people do, actually. So
Mm-hmm.
if you look in most grocery stores, I think they do it in Food Lovers, they do it in Woolworths. You can buy packages of vegetables for cheaper if you buy 4 packages or something. So they do it. I think, and that is the problem. I think with bundling, if you want to stop bundling, then one would actually say, okay, you can bundle, but don't include anything that's got a front of pack label. So the front of pack label would be on sugary beverages. So for example, you can bundle anything, but you can't have a Coca-Cola. Or you know what I mean? So I think that's part of the way of dealing with that kind of thing. There are other things that need to happen, I think, in terms of the food environment, is things like trying to buy local produce, boosting farming of healthy foods rather than sugar, so trying to change what's farmed in a way. There's also things about local procurement for supermarkets. So these big supermarkets, instead of trucking stuff all over the country, sort of trying to procure more locally. It's not always possible, because obviously in some areas you can't grow some things and so on. But I think there are lots of ways of looking at it that can change how we think about things. And I think you're right in many ways, is just trying to expose how things happen. What is happening in terms of, for example, the marketing. I think most people are not even really thinking about how marketing to children works. You don't really think about it. Most adults try and scroll through the ads quickly so you don't have to see them. But I think not recognizing that children are vulnerable. So there's a lot of things that if we expose them, I think people would be more supportive of changing the policies and less resistant, if you like.
Yeah, I think of these children's breakfast cereal adverts, and
Yeah.
it took me only into adulthood to figure this out. But they're all a kid playing on a soccer field and scoring an amazing goal to win the soccer match for his team, and then they're running and they're jumping over something, or they're winning their race in their local
Yeah.
swimming gala at their school and that sort of thing. And I'm just like, that
Yeah, if you
If
eat
people
my
only
cereal,
knew
that's
how
what's going to happen to you.
yeah,
Yeah,
if people only knew how contradictory and hypocritical it was. Like that,
yeah,
if you have that breakfast cereal, and you win your swimming heat in your local gala at your school, you've won it in spite of the fact that you've eaten that cereal, not because of the cereal.
exactly.
And
But I mean, those contradictions are everywhere. If you think and I think of Ronaldo, when the soccer player, when he was at one of these press things off conferences after a great match, they put a Heineken in front of him because they were sponsoring, and he refused. He pushed it away, and he said, "I don't want this."
mm,
Because I don't, and it's true. I mean, if these guys drink a lot, then they're never going to be great soccer players. Let's face it.
mm.
You know, it's all of these things are very like that, and the advertising makes you think differently.
Yeah. Another big thing in the gym is your energy, your sports drinks. Um,
Yeah, full
and
of
I mean
sugar.
that is yeah, yeah,
Yeah,
yeah. And I'm like, do yourself a favor, go get yourself a can of Coke,
yeah,
the real Coke, not the Coke
yeah,
Light or the Coke Zero, and go and get yourself a sports drink and compare the grams of sugar per
sugar.
100 mils,
Yeah,
and come back and report back to me and tell me if you
yeah,
thought it was
yeah.
what you had anticipated. And
And
it's
and they would
it's
have
quite
front of pack
astounding.
labels. Those energy drinks should have front of pack labels.
Yeah.
I mean, there are things that people don't understand. I mean, even I was shocked. Yogurt, for example. I mean, yogurt's good for you, right? It's a good thing. Those
Mm,
flavored yogurts have got so much sugar in them. They're not at
yeah.
all
Fruit
healthy for
juices
you.
are another big culprit.
Fruit juices are another one, exactly. We
Mm,
don't eat like 10 oranges in a go. And that's what
yes.
a glass of orange juice is.
Yeah.
Yeah.
What about then if you have like a system? Okay, so you mentioned the fact that you might have warning labels on for products that are quite high in sugar, but what about the opposite? What if you had different colored labels for foods that are very healthy for people, and you have it like a robot scheme, like a red, amber, green sort of thing, and
Mm.
then I'm just
Yeah.
thinking about the reality of what that might look like if you paying for your stuff, and all of a sudden
Mm.
you see you've actually got quite a lot of red labels in your trolley, and at some point the penny's going to drop there if you do that for long enough. I would like to
Yeah.
hope so.
There's been some
Versus,
research
okay.
on this.
Mm,
There's been some research on this because some countries do have that robot label.
mm-hmm,
I think France has it. And some of the research has been quite negative that what happens is that the industries try and, well, there are two things. The one is that a thing can have some healthy things in it. So, and people
mm,
grab at that. So, for example, if you've got a hot dog with lots of sauce on it, but you've got a piece of lettuce, people say, oh, well, it's healthy because it's got lettuce on it. So I think that that's part of the problem, that it doesn't balance out the negative, if you like.
yes.
And I think that's what also I think the research shows, but I'm not totally on top of it. So don't take this as final. But I think it shows that the industry somehow manipulates the robots and makes the thing look better than it is, and tries
Mm,
to fool people in buying things that are not really healthy. I think that's part of the problem. But I hear your point, and I think, look, I mean, I guess having warning labels is just going to help people make a better choice. It's not going to stop people. I mean, chocolate's going to have warning labels on it.
yeah.
Chocolate's going to have high in sugar and high in fat for sure.
Mm,
So, but people like chocolate, so you'll buy some. But I think it just brings out that kind of understanding of what it is that I'm eating.
yeah, it's subliminal.
That
Um,
awareness. Yeah. Yeah.
exactly. How close are we to that? Seeing that
That
in our
is a
stores.
That is $1 million question. So the regulation was published beginning of 2024. What happens through that law process is that then they have to call for comments. So then they called for comments for, I think it was 9 months. And now they've been sitting with these comments for the last year and have not come, nothing's happened. So the Department of Health are supposedly have to come out with the results from the comments and what the regulation is going to look like. And then they're still going to have to implement them. So they're going to implement them only because they've got to give manufacturers a period of time to implement. They can't just say, okay, tomorrow. So they have to, usually it's a couple of years, 1 or 2 years. So it's still a ways away, unfortunately.
So that, like we said, the wheels turn slowly. How do you on a personal level come to terms with the fact that much of the work that you're doing, the wheels do turn slowly and there's a level of bureaucracy? How do you stay motivated and driven when the work that you're doing now might only be fully realized in 5 years from now, 10 years from now?
It's a good question. Well, I mean, I've been doing it for a long time. So you have small wins over the period of time. So one of my big win, I thought, was in Soul City, we had a thing called Soul Buddies Clubs. And it was groups of children, and we taught them healthy stuff, and they worked together as a small community. And we did a study, 2015 or somewhere around there, where we looked back at children who had been in Soul Buddies clubs, who were around 20 years old, and children who hadn't. And we compared their HIV status. And there was a 50% reduction in children who had been in Soul Buddies clubs compared to those who hadn't. So
Wow.
I think that was a major thing. And I think for me, it illustrated that these things it's about more than the knowledge. So, these were about bringing kids together. It was about acting around issues, but it was more than just HIV. It was having social support. It was engaging with other adults. There were a whole range of reasons why this would happen. And so I think for me, they're little wins along the way. There's lots of slapbacks and changes.
Yeah.
But I mean, we've got some positive things. So the Department of Health has instigated a salt. It's a restriction on salt in foods. It came in not that long ago, and it's been implemented, which is good. And we've been able to show in some communities that there's a decrease in their excretion of salt. So people are getting less salt, which is good. The sugary beverage tax, although it's not adequate, but it came in 2018, so it's a slow win. It's a process.
Yeah.
It's things happen, and I think I kind of stay positive because I really believe most people are good, and they want what's good for them.
Has there been any research conducted on the effects of that sugar tax at all?
There's been quite a lot. That's one of the things that we've been doing. We've been looking at the benefits of the tax, that it has decreased people's consumption. It decreased it for a while. It's starting to increase again. One of the issues about the tax is that it's not at a high enough level. So, and that was directly related to the industry influence. So it should be, the tax should be around 20% of the exit price. And at the moment, it's around 10. So the impact is not as high as we would have liked, but there is some impact. And what is also interesting is that the equity issue is that the impact is highest at the lowest levels of income and the highest. So it's
Wow.
an interesting equity issue. So it does impact people who are really poor as well.
That's interesting, eh? So if you could be the big boss for a week, you are in charge of health for South Africa, what would you do? What would you remove, and what would you put in place if you can wave a magic wand and you had 1 week to make a difference, what would you do in an ideal world?
Sure, that's it. There's an alcohol bill that's been on the table in Parliament, the what's it called, the Liquor Amendment Bill of 2016. It's been there since 2016 and nothing has happened. So I would implement that immediately.
And what is that bill
that
proposing?
deals with restriction on alcohol advertising, deals with restriction on sales of alcohol at times. You can't sell at different times. It's quite a wide-ranging alcohol bill, which has not been implemented. I would definitely increase the sugary beverage tax immediately to its major and implement the front of pack labeling. And I would think about, I would also set up a health promotion foundation that's funded separately, so that when I'm no longer in the position, that other people can take it forward and start really having funding to make sure that there's prevention happening.
Wow, that's so interesting. A great answer. I'd vote for you.
Okay, I'm not standing.
Sue, one of my parting questions that I love to ask my
Yeah,
guests
yeah.
is there anything that you've changed your mind on recently? It can be anything. It can be relating to work. It can be absolutely anything.
Sure, that's an interesting question. I mean, I often change my mind because when people produce evidence, I accept it. So it's not something that's unusual. I am quite pedantic about some things, but I do often change my mind. What have I changed my mind about? I can't really think. I mean, I guess one of the things, I haven't changed my mind, but I changed not recently, but when I changed my career, if you like. I changed from doing the work at Soul City to coming to do full-time research in academia. And that's kind of a real mind change, if you like. It's a real shift.
What about it made it such a big shift?
Well, it was a move from working directly with people in communities to kind of stepping back and trying to look at what it is, trying to understand in a deeper way, if you like, different things, looking at a much more population level. So it's a different environment completely. I mean, there's a huge bureaucracy. We were working in an NGO, which is a different way of working. So that's very different. But I'm trying to think of things that I've changed my mind about. I've changed my mind about going to see the Northern Lights because I found out that they're Southern Lights. So I'm thinking of trying to see the Southern Lights. It might be more affordable.
That's pretty cool, eh? I didn't realize there were Southern Lights.
No, I didn't either.
That's on my bucket list too, the Northern Lights. I'd love to go and see that. Okay, so you're gonna head south instead of north.
I'll try. It's not going to be that easy. Apparently, it's New Zealand and Patagonia are the main places.
Oh, those are the two places, eh? Okay, that's very interesting. And that is that's a complete shift in career from being very people facing and very oriented towards the individual and the individual circumstances and day-to-day living versus then moving completely on a macro level and seeing, okay, what is happening if we combine all those individuals and their individual stories and we put that all together, and then what patterns are emerging on that level. Do you have a particular preference, just out of interest, about those two ways of working?
No, I enjoy both of them. I mean, the core of it is research, if you like. So I enjoy both of them. But I do miss, especially the buddies clubs. I miss the kids and I miss working with them. That they were my favorite.
Is it?
Yeah.
Okay. Well, maybe you might find a way back to them in some way, shape, or form in the future. Sue, it's been an absolute pleasure to have you on the show. Geez, you guys are doing such amazing work. And as a fitness and health professional, obviously I'm very passionate about self-improvement and about people making conscious, healthy decisions. And you guys are just doing a tremendous job of fighting the good fight as far as that's concerned. So keep it up. And if people want to get in touch, if they want to find out about the work that you're doing, where can people find you? Where can we direct them?
There's a website, It's www.priceless.ac.pricelessa.ac.za.
Okay, I'll attach that in the show notes as well for people to go and check it out. And I've spent some
Cool.
time on that website as well, guys and girls, and there's resources there of loads and loads of different research studies and papers that have been published. So that's definitely something worth checking out if you want to get your health geek on. Sue, thank you so much for being on the show. It's been an absolute pleasure.
And thank you for having me. I really appreciate it.
Hey everyone. A huge amount of work and effort goes into producing this podcast, whether it's from the research going into the episode, whether it's finding the guests coming to the location, or them being online, to producing the content, edited and putting it in a format that is conducive to your ears and your eyes. And it goes a really, really long way if you can just do me one thing in return for this free content: share it. Share it far and wide, and if you find an episode useful, send it to someone who might feel the same way. That's all. Thanks a million. See you next week.